All right, it's 5/22/2024. This is Carnivore Ken, your favorite carnivore, back again for a health walk and talk. Right here, this is my bass pond. It's not my own private bass pond, but I have put a lot of bass in there. So anyways, I enjoy walking around this pond using my wacky worm, catching the big 20-inch bass and just letting them go, not eating them. But anyways, I am back to remotivate everybody and rededicate everybody to getting metabolically healthy. We all know, maybe you don't all know, but anyways, there's been a new report. And mind you, before I even start, I want to say right now, everything I'm saying is just my opinion, but the facts that I'm going to tell you, I have read or heard somewhere. So I'm just not making them up out of thin air. But nothing I say is medical advice. So, it's just me, just a guy from YouTube. I will say, since I retired though in 2014, is now 10 years later, I have educated myself on a lot of health related topics, because I have always been interested in longevity, even knowing I haven't always been the healthiest guy myself. And I think that's why I have high calcium, because remember, everything's my opinion, but I believe the cause of arterial plaque is not the saturated fats, it is the sugars, it is the carbs. That is what is burning up your endothelium, the lining of your arteries. It is not saturated fat. It is not your LDL. You are born with LDL. I don't think Mother Nature would have you come out with something that is inherently bad for you, all right? As a baby, you are born in a state of ketosis. I don't think ketosis is bad for you. That is how you are born. All babies are born in a state of ketosis. I think the real crime is that Americans and people around the world have been sold a box of lies about what is good for you and what you should consume, and what you should avoid, like good old Mother Nature sunshine. Everything, I think, a lot of things. It's all been make-believe, because it's all just big food, big med, big pharma trying to turn a buck. Things that are good for you and completely natural, there's no money in it. So they're not going to put out studies and promote it because there is no money involved. I don't think that these big companies are your friends. If they could find a way to monetize fresh air and sunshine, they would. And then all of a sudden you would see all these studies out there that are promoting it. But that ain't gonna happen. I saw some little fishies. I always like walking around my pond just to see, how usually I'll see a bass swimming by or something, see how healthy the environment is. See if I spot any little bass in here, which I do right now. I see like a little 5-incher, so I know the bass I put in here are reproducing. I started planting bass in here in like the beginning of 2020 into 2019. But anyways, I think we have been sold a lot of lies just for money. I know that's a lot of the things they've sold us. It's just not good for you. In fact, it's horrible for you, you know. I think that, especially the food. I mean, look at the food. The cereal, folks, that you eat for breakfast has the little heart on it. You know, they're trying to claim the cereal is heart healthy. The you know, the Wheaties, the Cheerios, all that stuff. Complete garbage. All that cereals do is turn into sugar, which will burn up the lining of your arteries. Okay. Now, when you're young and you're healthy, you can get away with it for a long time. And but when your sugar levels start going up and your glucose starts spiking up over 140, that is when, according to Dr. Brewer, that is when you start burning up the endothelium, the lining of your arteries. So you need to be able to control your blood sugars. Do not accept being metabolically unhealthy. That should be a big no-no, because what you're doing is setting yourself up for horrible cardiovascular diseases. In fact, if you're metabolically unhealthy, you're doubling your chance of cardiovascular disease. And there's a long list of different types of cancer that you're significantly increasing yourself of coming down with. So do not think for one moment that you can have bad metabolic health and you're just going to be okay, because it's not going to happen. You know, people that have big trust in, you know, just going to the doctor and getting standard of care treatment. You know, most doctors in America, when you go in to see them, you get approximately, they are so rushed, and it's all about their prescription tab. You get approximately 7 minutes with your doctor. Think about it. How many times have you had the doctor come in, quick little talk, okay, out they go. Next thing you know, you're getting a script and you're going over and filling it, and you're taking it, and you're not even thinking twice. The doctor knows everything. They don't ever talk to you about lifestyle, about anything else. In fact, my doctor never even mentioned a lot of anything to me when my hemoglobin A1C started going up. Not one mention. All he cared about was the high LDL. Totally disregards my high HDL and my super low triglycerides. They don't even care. They don't even think about metabolic health. All they do is standard of care. So what happens? Your LDL is high. They put you on a statin drug, all right? And then you take that statin drug and your LDL drops below 70 and you're all giddy. You're all giddy, you're all excited, you're still feeling okay. You're not having massive amount of side effects because you're not a very active person anyways. You're a desk jockey. All you've done your whole life is you know, mainly work behind a laptop somewhere, sitting down most of the time, maybe going off golfing and watching sporting events, a little gambling here and there, going to the casino. But you're happy, you're eating the food you want, you're taking your statin drugs, and you think you're just fine. Well, what happens after that? Statin drugs can lead and help contribute to type 2 diabetes. So as the years roll by and you're giddy and you're happy with your low LDL, eventually you start having sugar problems. And you know, you go on these diets, you lose a bunch of weight, and you go, you know, nobody can stick to it. You can't, low calorie diets do not work. You will always regain your weight. It's not sustainable. You can't sustain that over the long haul. So if you lose all this weight, you know, your sugar may come back into balance for a little while. But because you're on a diet that you cannot stay with, weighing and measuring and being hungry all the time because you're eating all these supposedly healthy carbs that you're pouring down your throat, eventually your sugar goes bad. And eventually, because of the statin drug you're taking that helps contribute to the you eventually have higher problems with your metabolism and being able to control your hyperinsulinemia. You end up going high enough on your hemoglobin A1C that then they decide you are no longer pre-diabetic, you are now type 2 diabetic. So what do they give you? They give you a metformin pill. So you can, medicine. They write you a script for metformin, and now you're good. You're bringing down your hemoglobin A1C, maybe it got up to 9, and you're dropping and you're dropping and you're getting into your 7s. Still clearly above the range. You're still in the type 2 diabetic range, but you're giddy. Your doctor doesn't really say too much to you because you're on metformin and you're getting older and you're in your 60s, and you know, 7s in your 60s completely normal for, you know, that's just kind of way it is. You know, most Americans are metabolically unhealthy. In fact, 88% of Americans. So you're okay. You're not feeling bad. You're taking your statin drugs. You're taking your metformin. Do you know, just as a little side note, that 54% of Americans 65 and over are on 4 or more meds. 4 or more meds, folks. That's 55% of Americans over the age of 65. All right. Now, mind you, way back when you started on your statin drugs, well, there was also another pill you started on. And what was that pill? That was for your high blood pressure, because you're eating basically the standard American diet. You're taking your statin drugs, your LDL is below 70, and your doctor is giddy. Your doctor is happy. You're happy. Well, oh God, you have blood pressure problems. So here comes another prescription pill. Now you're going to be on blood pressure medicine, but no big deal. Your doctor seems happy, and you know that doctors know best. So you take that blood pressure pill, you take that statin, you're getting older, oh, this is just something that happens. So you take your metformin, everything seems okay, you know? And all of a sudden, you start, you know, you're 66 years of age, and you start getting dizzy spells. And you know, you've had it for a long time. You think it's just normal because, you know, you're always looking at your computer screen. You think maybe it's a muscle problem because of the way you've been setting. But at one point, you finally decide you better go have this check. And mind you, on top of all of that, your sodium level drops. And when you get contacted by your doctor after you go in the office and they realize you did a blood draw and your sodium level was super low, they want to take you to the hospital via ambulance. Because what can a low sodium level do to you? Oh yes, you can go into a coma. You can have a seizure, you know. But of course, all these years you've always followed what the doctors have told you. In fact, even during what happened in 2020 to everyone around the world, you followed the standard of care, and you just did what everybody else, what the narrative was, what you should do, and jumped right on board. Because doctors know best. Everyone knows best. Everyone knows how to eat healthy, how to follow that food pyramid. Everybody knows you just take your pills and you're good to go. Well, anyways, go back to the story. You go to the doctor, you know, take the blood draw because you're not feeling right. He calls you up, oh my God, you got low sodium level. We gotta take you to the hospital. So you go to the hospital via ambulance because they don't want you driving. You could have a seizure. While in the hospital, they decide they're gonna do an MRI to see why you are dizzy, see if anything's going on. And sure enough, when you take that MRI, they find a brain tumor about the size of a pea. Unfortunately, not only that, they do a body scan after that, and they find a little something on your pancreas. All right, the one on the pancreas they don't think is cancer. They're just going to go ahead and scan you again in a year, and you know, hopefully whatever that, you know, thing is on your pancreas that shouldn't be there won't turn into anything, you know, because everybody knows pancreatic cancer is you know, I guess no big deal, right? So they don't really bother with that. But now, right now, they're going to focus on that little tumor inside your head, about the size of a pea. And unfortunately, it's in an area of the brain that they can't operate on. Okay, they can't do nothing about it. But hopefully, it's not cancer. But they're going to do a biopsy. So they decide, they schedule you for a biopsy. Mind you, you're going to stay in the hospital all week long because of your low sodiums. Your body is just, you know, you're so metabolically unhealthy that you need to be there. So anyways, they go ahead and they do this biopsy of this tumor. And sure enough, they find out that is I believe it was like I'm talking about a true story here. A glioma. I can't tell you exactly what it is, but it's an inoperable brain tumor. All right, it's an inoperable brain tumor. And what's the standard of care? Of course, radiation and chemotherapy. Standard of care. Of course, doctors know best, so you're going to do the standard of care. All right. And through that standard of care, if you didn't do anything, you have approximately 90 days to live. Because this particular type of cancer in your brain is a very aggressive type of tumor. And unfortunately, it's in, even though it's small, it's in an area of the brain where they cannot operate. So, you got a couple choices to make. Take the standard of care, and they can extend that 3 months out, according to Dr. Shafee, 15 to 18 months. And Dr. Shafee is a doctor I trust. Okay? That's what the standard of care will give you. 3 months with no radiation chemo, or 15 to 18 months with radiation and chemo. Okay? And of course, when you go to your oncologist, is he going to approach you with any other options that can possibly give you hope? Are they going to mention Dr. Seyfried or Professor Seyfried or Dr. Shafee, who is a neurosurgeon experienced with these types of cancers? Professor Seyfried is groundbreaking. He uses metabolic therapy for all types of tumors, and specifically for cancer anywhere in your body, but brain tumors especially. And he has studied this stuff, and you know, it is not the standard knowledge out there because it's hard to monetize metabolic therapy. All right, there isn't a whole lot of money, unfortunately, to be made on people eating a certain diet or fasting a certain way to help you beat a cancer in your brain that basically they're telling you is going to kill you. Even if you take the standard of care treatment, there really is no hope. All right, but according to Professor Seifried, Dr. Shafee, who have had patients, numerous patients with your type of cancer, when you go and you do metabolic therapy and you get what is called a GKI, glucose ketone index, if you can lower that enough, in the case of brain cancer, you want to lower it down to 1. All right, down to 1. How hard is that to do? Well, myself, my GKI, when I do a 24-hour fast, and because I am a carnivore-based eater, very few carbs, my GKI will get down to in the 3s, which is good for people that are metabolically challenged like myself, because my hemoglobin A1C is not that great, but because I do eat extremely low carb, I can get my GKI down low with a 24-hour fast. And I can get into the 3s, the 3 to 5 range, which is good for people that are pre-diabetic or type 2 diabetic. But what do you have? What does this person have? He has a brain tumor. And mind you, there's a new article out there that I just read. It's from a study over in Asia that type 2 diabetes tend to get the more aggressive types of brain tumors. So if you are a type 2 diabetic, you are up in your chance of getting a more aggressive type of brain tumor. It's all related, folks. It's all about metabolic health. You cannot depend upon standard of care. This person that I know, if he goes into his doctor and all they recommend is a well-rounded, healthy diet and the standard of care, this person is probably looking at 15 to 18 months. And I am only saying that because I am getting that from the doctors I trust. I would rather use some metabolic therapy, and the reason it works is because cancer has 2 major energy sources: glucose and glutamine. All right, glucose and glutamine. I don't care, and let me state one thing right now, without being dogmatic about the carnivore keto diet. If you want to be a vegetarian, a vegan, or whatever, and you have this condition, if you can get your GKI, your glucose keto index, down to 1, eating a vegetarian diet, by all means, you probably can be very successful. In fact, Professor Seifried, he isn't dogmatic about what type of diet you are on, just that you need to get your GKI down. And you're going to have to use the standard of care therapy to beat a brain tumor. For example, you're going to need the radiation and the chemotherapy, but you need to attack the energy sources for, in this case, a brain tumor. You have to attack the glucose, and you have to attack the glutamine. Unfortunately, this metabolic therapy works great in cancers that are not in the brain, because you don't really, you can get your glutamine and your glucose will drop with the metabolic therapy. But you're still going to have too much glutamine. And brain tumors operate more on glutamine than they do, or glutamine, more on glutamine than glucose. So what you're going to have to do, you're going to have to get your doctor, your oncologist, or some doctor is going to have to discover Professor Seifried's method and they're going to have to give you prescription meds to lower your glutamine, all right? Because your diet and your water fasting will help you lower the glucose. You need your meds to lower your glutamine. You need your meds, your radiation, and your chemotherapy. You have, because it's an aggressive type of brain tumor, you have to attack it from all sides, all right? And it can work. It can work. Dr. Shafee will tell you that there's been cases where you can either significantly extend your life decades, or these tumors that are inoperable, unfortunately, disappear where they're no longer can be seen on MRI imaging. This can happen, but you have to embrace it other than the standard of care. Standard of care, you have to use it because of the predicament that this person is in. You have to use it. Now for this particular person, because they are on the standard American diet, they eat meats, they eat their white rice thinking that's healthy. White rice just turns into sugar. What I would recommend, so it's not just a restrictive carnivore diet, what I would recommend, starting out with several 72-hour water only fasts to begin with. Eventually you're going to want to do a long 21-day water fast, which is hardcore, but you're just starting out your treatment, so you want to work up to that. Water only fasting is just like everything else. It's just like running, walking, pushing weights. The more you do it, the easier it becomes. I am currently doing OMAD, and I'm very, very comfortable with it. When you do get hungry, you just drink water, you push right through it, and after you do it for a while, piece of cake. And that's the way the 72-hour fasts are, and that's the way. I've never done a 21-day water fast. I'm not going to say I haven't never done it because I never had brain tumor. But if I had a brain tumor, I would do a 21-day water fast, and I would take it extremely easy. I would take my electrolytes. I would let my doctor know what I am doing, because you're on the metformin, you're on the blood pressure pills, and guess what's going to happen? As you get more and more healthy, because your metabolic therapy that you're taking to fight off your tumor in your brain, you're going to eventually have to drop your metformin doses, because otherwise your sugar will go too low and it'll get very dangerous. You're going to have to drop the doses of your blood pressure medicine, because you eventually won't need those blood pressure medicines anymore. You eventually won't need the metformin anymore, because that metabolic therapy will significantly increase your health. If you weren't already with a brain tumor, it would help you anyways to do metabolic therapy. If you're that metabolically messed up, you're just a cesspool waiting for a chronic disease to take hold, such as cardiovascular disease or some type of cancer, which in this case did, unfortunately. So, folks, listen, for especially this one particular guy, eat meats, eat eggs. Eat meat and eat eggs and eat real butter. No seed oils, period. If you want to have a few berries, or maybe some walnuts or pecans, they're high fiber nuts, a few. This ain't me, you're just gonna lounge around and eat them. Some berries, pecans, walnuts, maybe some macadamia nuts. All right, that gives you a little variety. The rest of your food should be different types of meats. You can eat fish, beef, pork, lamb. You know, I even chicken wings, fine, as long as they, from Buffalo Wild Wings, by the way, they cook their chicken wings in beef tallow. Stay away from all fats that are not from animals. No vegetable oils whatsoever. If you're gonna not follow that type of diet and you're gonna eat your salads, look what's in your salad dressing. All right, a lot of those salad, ranch dressing, Thousand Islands, all of them. What do they have? They have seed oils. No seed oils. And you should be drinking, other than maybe black coffee, a couple cups in the morning, or some type of tea which has no artificial sweeteners in the morning. Just get yourself up and going. The rest of the day, you drink nothing but water. All right, period. If you start feeling a little funny, you might have to take some use a higher quality pink Himalayan salt that has you know, most of them have several type of minerals that keep your electrolytes in line. No more Diet Coke, no more Coke Zeros, no more sugar-free Mountain Dews, nothing, zilch. No artificial sweeteners. You don't want to be putting all those chemicals that are not natural in your body. And what can possibly happen from all this therapy that I'm talking about? You could possibly make that brain tumor where they couldn't see it no more and live a much healthier, normal life. No longer walking around with a big old belly and a fat old face that's so fat you don't have any wrinkles. That doesn't mean it's healthy, right? That's it, folks. I've been ranting. I just want to talk about, you know, the main thing. Do not accept, none of us should accept being metabolically unhealthy, because something bad will eventually happen. That is what causes cardiovascular disease. If you want to know why you got a high calcium score, it's because you burnt up the lining of your arteries through your sugar consumption, through your you know, your chocolate covered almonds, your muffins, chocolate chip muffins, your big bag, 3-pound bag of white rice, your half open bag of crackers. I'm only describing what I see in my house because I'm the only carnivore. You know, you want to complain about your weight, but yet you're eating all this stuff that you have to burn off before you can ever tap in to burning your fat stores. You sit there and you eat all those carbs, all that sugar, all that packaged processed garbage, and you want to sit there and complain about your waistline or how you know, and you exercise. Remember, before you're ever going to tap into the fat, all that garbage, pollution, food things, they call it food, which should really be a crime. You got to burn all that glycogen off your bodies before you ever are going to tap into your fat store, so you're not going to lose no weight. All that garbage you pour down your throat, you have to lose that first, folks. I see bass rolling out here. Anyways, I just want to say, be willing to be uncomfortable sometimes. That is what it's going to take, especially if you've been doing what they've been telling you to do all these years. Trust your doctors, take your meds, well-balanced diet, stay away from your saturated fats. Here's your Cheerios, here's your Wheaties, here's your Lucky Charms. Oh, eat your whole wheat bread, eat your whole wheat muffins, eat your boxes of that spaghetti and macaroni and cheese, eat your lasagna, eat your pizza. Folks, it's a crime. It should be a crime. They're setting you up for failure. All right, you can thrive. You can be out there doing things, unbelievable things. I am 64, gonna be 65 this year, and I'm telling you, the more I tighten up, the greater I feel. I stopped my artificial sweeteners. I am going, this Thursday it'll be 5 weeks. Nothing but water other than 2 cups of black coffee in the morning. I was addicted to artificial sweeteners, addicted to the Coke Zeros, you know, because it gives me that little caffeine hype. What happened is, though, I'm over it. If you push it out long enough, you get over it. And that ice cold water, as I drink it down, to me it's refreshing. It's actually good. I mean, I drank a lot more. We're going through a lot of water around here because all that stuff that I was drinking that was full of those chemicals and artificial sweeteners, I replaced it all because I want to fix myself before I get a bad diagnosis, right? You should want to fix yourself too. Do not accept being metabolically unhealthy. I'm going to get my hemoglobin A1C down below 5.6 one way or another, and I'm going to use the glucose ketone index as a means to monitor my progress. I'm going to make sure I'm routinely down between 3 to 5 on the GKI. All right, remember, brain tumor, you got to get down in the ones. All right, any type of cancer, I would say get down in the ones. You know, take away the energy source for that brain tumor. All right. Anyways, what did I do today? I did do a long distance run because I wanted to update my suntan and get some beautiful vitamin D from Mother Nature into my body. I went out and I ran 5.50 miles, never stopped, hoorah, motivated, dedicated, and I kept on going the whole time, and I felt pretty good. And I know I'm burning fat for energy because I am a fat burner. And then I did a little ab work, little upper body, not too much, in the garage. And that is how my day has went. And so far, I'm loving life and feeling good. I've had great results from my carnivore diet. I'm hearing great reports out there that carnivore diet, people don't think you can cure MS. Well, I'm hearing reports that MS is disappearing. IBS, irritable bowel syndrome, basically gone. Crohn's, gone. All through the carnivore diet. Keto diet is good. I'm not gonna say it's not, but carnivore diet is a step above. I'm right on that fine line. I barely take in any carbs. Maybe a few blueberries, a few pecans, just to make sure I have vitamins from a bigger frame. But I don't do it all the time. I eat carnivore. In fact, I saw a new carnivore recipe this morning for pancakes, man. It looks good. Of course, you're not going to put sugar-free syrup on top or any type of syrup. You're going to use butter, not margarine that's full of seed oils. I see that in my house too, in this non-carnivore house I live in. Margarine, not for me. You know, if you're metabolically healthy, I guess you're not at the, the problem that I have. I'm not metabolically healthy. My wife is metabolically healthy. I mean, her fasting glucose was 71 on her last physical. Good for her. They didn't even check the hemoglobin A1C on her, which my doctor hasn't been checking mine unless I ask for it. In fact, my doctor doesn't even require a fasting blood test. How insane is that? I'm gonna give him a fasting blood test anyways. So, anyways, I'm gonna let you go, and I hope everybody's staying motivated. Make sure you get your exercise in. I tell you, give carnivore a try, because I think if you do it for 90 days, you'll be hooked. People don't believe it. Also, do some water fasting. If you're not metabolically healthy, which 88% of us aren't. Don't accept that. All right. Have a great day. Stay motivated. Carnivore Ken out.